Right away, I see a hip hike over there on the left.
Definitely. And there's information if you look at the way the back of his legs are. And if people can't see the hip hike, look at the shorts, right? It's great if you're not sure. I mean, look at his shorts.
Oh yeah.
Either he has a longer leg, which is possible, or he's really hiked on one side, and often you can see it in the clothing.
Mm-hmm.
So when you walk by that mirror, or that window, take a look what your clothes are doing.
Yeah.
You see with the knees there, there's definitely something happening.
Yep. And he has reported to us that he has pain in his left leg in the calf area. So we're talking right over here.
Mm-hmm.
He says it's intermittent pain. I've had that, so I can relate. And go figure, that's where the hip hike is, left.
So what else do we know about him? Does he have one leg longer than the other?
I
And
don't
I
think
just
so. He's got
ask,
some.
I always ask, because sometimes people
Look at
have,
his hips. They're
I am
touching. His thighs are touching.
in that picture, but in his back picture, they are not.
Huh.
So that tells me his stability is off because he doesn't have a consistent way he stands. He's looking for stability. First one, he's squeezing his inner thighs to create stability. Second one, he's opening and using his abductors to stand. But he can't find comfort because if you go straight up, look at his spine, Kevin. His spine has a curve in it.
Oh
So
yeah. Oh
that
yeah.
is why I inquired about the long leg, only because this is a really good example of how everything is connecting. His spine straightens up a wee bit when he takes a wide stance because he can disperse the weight. And when I mean straighten up, that overly developed spot on the right gets a breather. Yeah,
Look
like
at
it's
this
indented. You can see it for
right
sure.
here.
Yes, sir. I have something like that too. It's just, and other people might, right? If you guys are out there, just put your hands behind you and rub that area. Is one side more developed than the other?
Yeah.
That is the telltale. So
Yeah.
he's got an overdeveloped right side of his erectors or his
Yeah.
back, if we want to keep the slang.
Yeah.
So now go look at, he had another picture. I think if you scroll down, you can see. I guess it was more in the front.
Got quite a interior pelvic tilt.
He sure does. And what do you notice on the left versus the right?
Well, he's got a rotation, big rotation going.
He does. His
Yeah.
left hip is higher on the, can you see that in the clothing again? And I love looking at clothing because people, just draw a line across this side, the front, and you'll see, he doesn't look as much tipped. Like if you're a pail of water, in this particular picture, he's tipped a lot. Like there's a lot of water rushing towards his toes. If people are visual learners, he's tipped. That's what Kevin and I are talking about. He has an anterior pelvic tilt or a tip. And when we look at the other side, you'll see it's a little more stable. And
Yeah.
I think that's probably why he's got pain, because that anterior tilt is still a tilt.
Yeah. I can't make a
Not as pronounced though.
I can't make a diagonal line, but if I could, it would be like whoop. It would be
Yeah.
a
And you can
slide.
just see that. Remember when we looked at his back? This is the side where the back, and I am suspect the psoas, our favorite primary hip flexor,
Hmm.
are on. And they're not getting the message to turn off so the other side can do. And then we have an imbalance in the hips. We have a hip hike. We have a hip rotation.
Yeah.
And this person needs to get their spine aligned and their hips out of rotation. And then he'll flourish because he has strength,
Strong
right?
glutes, strong
Yeah.
glutes.
Well, we see strength, right? We always see strength. We're like, okay. And he's out of balance, right? He's got no belly muscles. He's a little descended. I'm
Yeah.
sure you and him could talk about nutrition because when your organs kind of have nowhere to go, they're supposed to snuggle back into your spine. And when they start dumping forward, all sorts of things happen as well.
But the thing that jumps out to me though, Rain, is this left rotation here. You can hardly see his hand.
Mhm.
He's
Yes.
very rounded forward, and you can see it here. His hands are visible from the front.
Definitely. Well, he's also sort of sliding off on the right side. You know, you can almost see that arm is just, it's kind of melting off. So we've got an arm, the right arm, that's not using any shoulder stabilizers. And we can see that if you go to the shoulder blade on the back side, they're not snuggled in. They're strong, but they're not snuggled in. Like we
There's
can,
a
yeah,
difference.
there's a difference. And yeah, there's a difference. That's actually it. There's a difference.
Yeah.
And that's why we need to always follow the protocol. We need to reduce rotation, stabilize the pelvis, work from the inside out, and really rehab this gentleman's psoas muscle. He's
He
got
also
an
he also reported that he had shoulder surgery 10 years ago, AC joint. No, I'm
really.
sorry. I He didn't have surgery, but he dislocated his shoulder, his AC
Mm.
joint, but he refused to have surgery. So,
Surgery is always an interesting choice. It can over tighten you, or it doesn't. It's not always the best choice. Sometimes it's the perfect choice, but not always. He's
so
got
that,
a lot of tightness in his lumbar.
yeah,
So if you were to highlight for people out there, from below the left shoulder blade across, you can see the like how you draw your boxes.
yeah.
That whole area is just, yep. And then just slide it to the center. Go right above include his sacrum, right? Like right above his bum crack, for lack of a great word. Yeah, I just pull it all the way over. Yep. Boom. And then we'll just tighten it up a little bit. Fantastic. Well done. Dun da da da. I just want you to look at the actual. Okay, first of all, we can't see spine, body muscles protruding. And just pause for a moment, because it's not a good or a bad, but on some people, you actually see their spine protruding because they're in so much flexion, especially on a very thin person, right? You see the knobbies, if we want to get layman's terms. No
Yeah.
knobbies here. This man has got all erectors on all the time, 24/7. And then therefore his shoulders have sort of gone to Hawaii,
Hmm.
because holding himself up from his back, and the imbalances in his hips is probably, he spends a lot of time in that posture. Stands on the left leg, stands on the right leg. But this area is muscle. Like we can literally give this man so much more space with posture therapy.
Yeah.
And a lot of it's going to be that lie down,
Yeah.
that first static extension, static back, and
Oh
he'll feel
yeah.
so much better.
And again, he's complaining of pain here, and
Yeah.
that would
Well, look
work
at the
itself.
alignment.
Yeah.
Look at the
Once you go
alignment.
into alignment, that's going to work itself out. It did with
Look at
me.
the muscle tone, even. If you
Yeah.
look at the left leg, the right has proper muscle tone.
Yeah. This is so out of balance.
Mhm.
And there's a big
It's
curve. There's a
internally
little
rotated.
curve here too.
Yeah, it's internally rotated. Can you see that?
Yep.
And we already know his body is rotating too. So I would suspect that one hip is doing more work than the other. And I'm going to
Mm,
keep it really simple, right? For our watchers, like, you don't need to know more. You just need to know when you're imbalanced. It's traditionally seen here by us. And so, you don't get this shot very often. So take your pictures, send them in, let us talk about you, and start looking in mirrors,
yeah.
because he's a strong guy. Like, he has muscle tone.
It's
His
internally
right,
rotated. I see it.
yeah, the left one's internally rotated and the right one's externally rotated. So when you have that, right, the right leg is driving, but it's so strong, it's going to push him onto his left side. The left side is not the strong side, so it spends a lot of time on the lateral side, as you can see the overdeveloped of the outside of the leg muscles catching righty, because righty is going to throw him left. And you have to just imagine, like, perhaps a car with a smaller wheel.
Yeah.
Because the hips are out of balance. So the structure is out of balance. So motion's out of balance.
Yeah.
And we can help this guy. It'll be great. I would love to know more what he's telling you about, or if the knees are the focus, then this would be great. So I had Dr. Reese. Yeah, we don't need the volume. I just want people to look at that for a minute, right? And we're using a rod to help somebody understand their posture. That posture, right? You're looking to see, I love the bones better. So if we had this gentleman just start doing squats with his feet straight, perhaps your broom handle down your back, it goes on his sacrum, it goes on the rib cage, it goes between the shoulders, and it touches the back of the head. And then he just goes into a little squat. He's going to notice he's going to rotate. Right? He's going to rotate. He's going to be like, oh my gosh, I rotate. Then I would say, call us, right? Because you rotate. This is a really wonderful way for you guys to realize that posture is functional. You take it with you. That's why when Dr. Reese says, you know, it's the body you take with you to the activity. This structure for most athletes is ready position, right? Tennis, ready position. Baseball, ready position. I don't know if wrestlers start here, but you know, it's an active, ready to go hip, ready position. And then this is what becomes of most humans. And as you can see, you know, this is an issue. This is a posterior pelvic tilt. This happens a lot when either A, you're over controlling your abdominal muscles and you've gone too into the flat belly syndrome. So, right, you suck in your gut, because a lot of people think that's how it works, and it's not. You've got to rehabilitate the hip, right? The psoas muscle with the glute, with the rotators, with the inner thighs, with the outer thighs, with the quads, with the ankle. There's no way to, you know, again, anyone who's done a downward dog, look at the space right there. And everyone's like, oh, this feels great. My calves are stretching. My hamstrings are stretching. Great. Wonderful. But we're not rehabbing the pelvis yet. We're not doing the work. We're just getting a nice stretch. But when she bends her knees, or whomever it will be, the knees will get bent. And this would really help that gentleman because it's going to stretch and activate the calves. Dun, da, da, da. And this is all you guys have to really understand. Your posture dictates your ability to move correctly.
Yeah.
This person is sitting in a chair. If you're a good, you know, visual. Again, here, I see this in the gym all the time. What is that? Well, it's a beautiful protraction of the shoulder blades, tons of abs, but we're killing the neck and the shoulder connection. And then we're going to go and look at our phone. Not good, Dr. Reese. We can't have this. So we have you guys do a lot of this thing called static extension, static back. A lot of times people freak out. They're like, I shouldn't be doing this. But we're trying to turn back on these muscles. I love these pictures because when I see someone in this shape, I know they can stand up. If you can do it in a crawl, you can stand up. And if you guys get down on your hands and knees and you're all rounded like the first lady with the rod, we know your whole back muscle extensor system's not working. Now, this gentleman we had, he's going to do great because he has muscles. He's just going to be amazed at how crooked he is.
Yeah, he's not weak at all. He's just
no, he's not. He's just you know, when you wind something up one direction really tight, he's ready to spring. And I think he's going to be really satisfied with posture therapy because honestly, when you start lengthening somebody into their full ability to take up space, which again, we're going to start with those hips because the hips are driving, as you said, the hips and the back are not connecting. And I'm going to absolutely say the psoas muscle is imbalanced. And then all the hip muscles around it, right? Because that's not real lumbar curve. You see how sharp that is?
Yeah, it's like a straight, it's like his pelvic tilt. It's just a diagonal.
Yeah. I have a client that tells me it feels like rebar. Well, he's real, it's rebar up his back. But that's what it feels like. It's a jamming. And then from there, he's lifting his chest, which is why his arms are not connected to his body. It's a bit like a puppet, like the marionette guy puts your hand up there and then they
Gotta be some pressure going on right here.
Oh, there's so much pressure. And when the pressure is too intense, it goes down to the knees.
Yep.
And soon to the feet, because it's all one thing. I can't wait to help this gentleman. It's going to be because he's like ready, you know, he just probably wound up one direction and got stuck.
Yeah.
Like our tennis players, rowers, they get stuck. People who sit in their chair and spin around, they get stuck.
Yeah. I'd
Yeah.
I'd love I'd like to help this guy for sure.